Our programming is so special because of the people that work here, first off, and then second off because we are a trauma-informed center and we take into consideration the whole person. So that means mind, body, and soul. For our minds, we have an amazing medical team that is psychiatrists and psychiatric nurse practitioners, so they're top of the game. Our clinical team is amazing. They run group and individual therapy. All of them are trained in some type of evidence-based trauma modality and are phenomenal at it. For the body, we do movement all the time. So we have exercise every day of the week, and then we also do experiential where they get out and explore and have adventures. We also have the pro recovery diet, which is delicious, healthy food. And then for the spirit, we are very connected to the earth that we are here on. Acqua has this amazing energy that if you have not been here, it's beautiful, it's magical. We also do a sweat lodge on a consistent basis that is connected to the Lakota spirit. And then we also incorporate a variety of self-help groups. So we use Dharma Recovery, which is a Buddhist-inspired recovery group. We do 12-step groups, so that's Alcoholics Anonymous and Narcotics Anonymous. And then we also do Smart Recovery, which is a CBT, which is cognitive behavioral therapy-based self-help group too. Trauma is an experience where a person feels that they are in threat or jeopardy of their life or their physical well-being. Many people have a variety of traumas. It also can be an emotional component too. So it can be an attachment or a ruptured attachment, so to speak, and that can be anything from family of origin to school. And then trauma also impacts the brain. And so that's one of the things that we look at here is the neuroscience of understanding both addiction and trauma and how that impacts the way people operate in their behaviors. The veteran population is unique. They have this connection and brotherhood that they have often lost after they've left the military, for whatever reason they left the military for. And I think we do a wonderful job of safety and security and connection that they're able to find that a little bit again. And that's really healing, in addition to all the wonderful work we do around trauma. Our clinical team is really special, really amazing. They are thoughtful, insightful, energetic. One of the things I think that I appreciate the most is none of them are afraid to challenge, to look at discrepancies in behavior and words and put together connections that maybe our clients hadn't seen before and didn't understand, and so to push the envelope with them in a loving, nurturing, supportive way, not a in-your-face, punitive way. That takes a special nuance to be able to be direct and challenging and loving and supportive simultaneously. So treatment modalities, I'd say when I look at group therapy, one of the most important modalities for us is process group. So in residential and PHP treatment, they have process group 5 days a week. In our IOP, it's 3 days a week. They have process group 3 days a week. And so that's an hour and a half of looking at what do you need to work on? What is the emotional content of your life that you are looking to work through? It can be past, present, future. And how does the group connect with that? How do they relate to one another? And so it's this dynamic of two people helping each other, except for maybe it's 10 people helping each other, and having a similar experience around the emotion. So, and then all other groups that we do is cognitive behavioral therapy, dialectical behavioral therapy. We use connections, which is Brene Brown's Shame's Resiliency. So that's also looking again at that trauma component and how that manifests in the core beliefs. We also do the neuroscience of addiction. So those are pretty core group things that we do. On an individual basis, all of our therapists are trained in evidence-based trauma modalities. So we use eye movement desensitization, which is EMDR, internal family systems, also known as parts work or IFS. We do inner child work. We use CBT and DBT as well. Developing a treatment plan is a collaborative process, which is one of the principles of trauma-informed care, is to be a collaboration. So we talk to our individuals about, this is what we see you might want to work on, what do you want to work on? And then together we put together the treatment plan. And then within our treatment team settings, we talk about what they're working on a weekly basis with our medical team and the other clinicians to see how well they're doing and where maybe stuck points are, what else we might want to consider. And also within that process, we're asking the client like how things are going, like what do you want to work on? Because that's evolving. What somebody comes in and thinks like, oh, I really want to work on this, may be different in 15 days when they feel different. So the recursive model is looking at what is the lowest level of care that we can help somebody. And so that doesn't mean somebody immediately has to be an inpatient, or if there is a slip, and the slip doesn't have to mean like return to use, it could also mean like returning to maladaptive behaviors that are getting in their way. What is the next step to help them the most? Sometimes that's an increase in level of care, sometimes that's an increase in case management, maybe to find more stable housing, maybe that's including the family to do family therapy to understand how the family system is triggering and like how they can heal together. And so it's looking at what do we need to do to find help and support of that individual with where they are to perpetuate what they want without necessarily going right back to higher level of treatment. So a co-occurring disorder can be trauma, right? It can be post-traumatic stress disorder, it can be trauma, it can be anxiety, depression, bipolar, schizophrenia. And so we look at what was the substance use trying to do, what was its purpose, because it's trying to fulfill something. And is it to give you more energy because you're feeling depressed? Is it to have you feel more relaxed because you're anxious in social situations? So we look to understand what is the purpose of the use, and then what are things that you can do to cope instead, right? And some people that might be medication, some people that's coping skills, some people that's spirituality, some people that's exercise. So working with the individual to find out what is most effective for their life and their recovery. So our clinical modality of how we look at substance use disorders is they're not the problem. Yeah, they're the problem. They're going to bring you in. They're the point where people are like, I've had enough. Maybe your family's had enough. Maybe your loved ones are like, you got to do something different, and it's now destroying your life. But they are the coping mechanism, and they are trying to cope with something underneath. And that often in our world is trauma. Also, it could be other mental health things, but it's often trauma, and what comes from trauma, of those negative core beliefs or negative cognitions of thinking like I'm not good enough, I'm not worthy, I'm undeserving. And so the substance use helps numb or escape those thoughts and feelings. So they're very interlinked in our world.